Nathan P. LaCroix here, Dickerson Insurance Services, General Agency, Individual Health. Licensed health agents, you're now organized with your spreadsheets, you got consent, the client wants to enroll on the exchange, and you just sent a quote. The main result, they'll have questions. That's the most common thing. The most common questions they do have are going to be the deductible, out-of-pocket maximum, what does that mean exactly? What happens if I need a surgery? Will I be denied coverage for having pre-existing conditions? And, well, especially if they have kids, what is the urgent care copay? So we're going to be talking about sandwiching the benefits. So all you really have to do is read off the specs on the proposal that you sent. For example, this Molina Healthcare plan. Easy way to describe any plan is sandwiching the deductible and out-of-pocket max between best case scenario and worst case scenario. So let's get into some example descriptions. Okay, so let's talk about best case scenario. You can tell the client, hey, if you look at this plan, the deductible is $2,000. You only start paying into that if there are major services, like a surgery, cancer treatment, or an accident. If all you do is go to the doctor's office once a year, maybe an urgent care or two, and you fill a couple of prescriptions, you're only paying the copays, as you can see here. Here's some copays for office visits and urgent cares. The out-of-pocket max is going to be your safety net. It's the most you'll ever have to pay for the calendar year. So the out-of-pocket, or OOP, is right here. If you're healthy, you likely will never have to pay into the deductible or ever meet this out-of-pocket max and just pay some copays here and there. Boom. Sandwich, done. Deductible on top, few mild scenarios in the middle, and the bottom piece, the out-of-pocket max. Okay, so that's best case scenario. Let's go into worst case scenario. So you can tell the client, so let's say you have a major surgery with follow-up visits, or you were diagnosed with cancer. That's when you start paying into the deductible. In this case, the $2,000. So if the doctor charges $500 for labs and x-rays one day, you'll have to pay the full price until you get to the $2,000. Anything after that, your coinsurance kicks in. So let's take a look at the coinsurance. It's 30% of what the doctor charges. So after you meet the deductible, if they charge $1,000, you're on the hook for 30% of that, $300. See, folks, that's the middle part. Now to end it with the safety net. Now, let's say you need cancer treatment. You're laid up in the hospital for a month, and the hospital decides to charge you $1 million. You're certainly not responsible for that 30%. It's too much. The out-of-pocket max, OOP, is the most you'll have to pay for the calendar year. On this plan, it's $7,000. So regardless of what the hospital charges, any covered benefit beyond the $7,000 price point will be paid in full by the carrier. See? Nice two examples there. So let's get to the close. So you can tell the client, if you have any other questions or are ready to enroll, let me know and we'll get started. And that's it. Really simple, everyone. Just reading off the benefits based on their scenarios. So next video, do a few practice runs, read through the specs. If you go to the doctors a lot, try finding out what your services would cost on a few plans you quote yourself. Bottom line, explain the benefits simply, using examples, using stories. Make it easy for these folks to understand. They aren't in the insurance industry, so they need some simplified verbiage. Sandwiching the deductible, best case, worst case scenarios, and the out-of-pocket, you're likely going to get through 90% of questions. Now on to the next video, the actual enrollment. Here's my spiel. You can skip if you've heard it already. I work for Dickerson Insurance Services. I love the company. I love the people, the culture, and I especially love working with the agents that partner with us. And I want to do the same for you. We are a general agency, not a super agency. There's no hierarchy, no upline drama. You don't submit business through us. Your book of business remains yours. You get full commission and carrier bonuses, paid timely with tracking, and we don't take anything off the top. We're here to train you up so you can quote and enroll on your own and help build your business with a formula for success you can follow. Individual at dickerson-group.com or visit dickerson-group.com. Click individual, agent appointments. Let's go.